there are many aspects to have good health, and according to some, holistic is as important as mental and physical.
Yes, and we also wanted to know more about Medicare members changing plans.
Today on Living 808, we are talking about seniors and spirituality, and we're back with a guest we've talked to before, Jose Cabrera from Humana, and we're welcoming to the conversation as well Jesse Seibel from Adventist Health Castle to add to the spiritual angle. So nice to have both of you with us on Living 808.
Hey, thank you for having me again.
Jose, tell us first off, we know there are those pressing deadlines for Medicare, some plans, and what should people be doing to get prepared for that and making their decisions right now?
Yeah, it's an important time of the year, and we got about 2 weeks left. December 7th is the end of our annual election period where folks get an opportunity to change the plan they have or sign up for a plan for 2021. And I think there's some really important considerations that someone should take when deciding what to do for 2021. Those things include the cost of buying a plan, you know, that member premium and how that's going to impact their budget. I think when we look at the cost of using a plan is just as important. You have things like co-payments versus co-insurance. It's very important to understand the difference between the two, because with a co-payment, you know, you can budget around that. You can plan around a co-payment. It's a very specific dollar amount that you may have to pay for, let's say, going to a specialist visit, or in comparison to a co-insurance where you may have to pay a percentage of the bill. So if it's an 80-20 situation, you may have to pay 20% of what's left over. And that's a little bit more difficult to plan around. So I think that understanding the cost of using the plan is important. And then, of course, the maximum you might have to pay within a year is very important as well. So understanding the maximum out of pocket that you may be exposed to in a year is very important when making your decision for what plan you should sign up for for 2021. Another important aspect is kind of that network that you're going to be associated with. Learn about the doctors and hospitals that are going to be included in your plan. Are physicians and preferred hospitals included? That's an important question you should ask yourself. And then you should always look at your cost of prescription drugs and the list of medications that you take, and if they're covered by that new plan going into 2021.
Let's bring in Jesse to the conversation, because Jesse, you have an interesting role dealing with spirituality and seniors, and tell me how that can be a benefit at this time.
Well, spirituality is just recognizing the amazing ways we're connected in our lives, our family, our friends, and our world. And spiritual health is maintaining those relationships, investing in them, deepening them, and getting you through some tough times.
And for people who watch you who might be thinking, how does this differ from religion? What would you say to them?
So spirituality can include a higher power. And if you are a religious person, then your religion should help you with those connections. They should be bringing in more love, more peace, more joy into those relationships. You should be finding more meaning in those relationships with your religion. If your religion is not doing that for you, you might be doing it wrong. But you can be a spiritual person and not be a person of faith.
How do you think COVID has affected senior in particular, their spiritual health?
So one of the most damaging things about COVID is it's taken our relationships, those who we spend time with, those that we can trust, those that support us, and it's turned those relationships, instead of a resource, into a risk because of how COVID is so infectious. And so especially for seniors who have had to quarantine themselves, live in some type of isolation, that really takes a toll on someone's spirituality.
Would you say there's any ways that they can boost it or improve their spiritual health?
Yes. I think one of the things that we can all do is practice spiritual disciplines. And those disciplines, sometimes I break them into 3. So reaching in, these are disciplines that help us reflect, self-reflection, journaling, meditation, just taking time for myself. There's spiritual disciplines that reach up. So those are more like prayer, studying scripture, things that call on a higher power. And then those that reach out. So acts of compassion, service, helping others, even acts of appreciation and gratitude during this time of year are all spiritual disciplines that can help us connect with others. But those who have lost somebody, sometimes the holidays are really difficult. And one of the things that we offer on island in many places are grief groups. Because of COVID, these are many now virtual, but they're open, they're free. And if you'd like to find out more information on how to join a virtual grief group, we'd love to hear from you at 263-5343.
Well, we thank both of you for coming in, giving us the full picture from the spiritual to the physical and medical side. Jose, Jesse, thank you so much for joining us on Living 808.
Super important, and a lot of people believe that it's 1/3 of getting your way back to full health.
Yeah, I agree. I've been practicing, like, I guess in a way, holistic health, as far as like affirmations, you know, telling yourself that you're worthy, you can do it. Just basically kind of just, you know, like starting your day off on a good note just by telling yourself that you can do anything that you put your mind to. And it works. I mean, I put on some good music. After that, I go for a walk, and I'm here talking to John.